Hi, my name is Grace Gager, and I'm a nursing student at the University of Michigan. I'm going to be presenting a patient to you. The patient is a 42-year-old African-American female. Her chief complaint is difficulty seeing. Diagnoses: difficulty ambulating, hypertension, hypothyroidism, depressive disorder, urine retention, type 1 diabetes uncomplicated, sickle cell disease, sarcoidosis, neuropathy, muscle weakness. Current medications: patient uses various eye drops for retinal detachment and regulation of blood glucose. Daily, she takes levothyroxine for her hyperthyroidism, losartan and potassium for hypertension, and neurotenine for nerve pain. The patient also receives medication for depression and multiple vitamin supplements. History of present illness. At the age of 9, the patient was diagnosed with type 1 diabetes. Patient had retinal detachment surgery on her left eye on November 24, 2014, in relation to her type 1 diabetes. She received Diamox after eye surgery, which led to complications with her neuropathy. Following her surgery, she experienced lethargy, which progressed into a loss of her function in her lower extremities, leading to admission to the emergency room on December 16, 2014. Prior to her eye surgery and emergency room visit, the only other major hospitalization was for the birth of her daughter. The patient is allergic to silicosis seen through the local edema it causes. Functional assessment. The patient reports no use of drugs or alcohol. Due to immobility, she does not exercise. The patient sleeps regularly unless she is bothered by the discomfort in her lower extremities or woken up by nurses or other patients. She counts her carbs on her own, but finds it difficult sometimes due to inaccurate carb counts on menus, which leads her to problems with her blood glucose. The patient normally cooks fresh food. Her only caffeine intake is 1 cup of coffee per day and occasionally a soda. Patient uses a sit-to-stand device as a measure of safety. Psychosocial data. The patient currently lives alone and is single. Her 25-year-old daughter occasionally stays with her. Her biggest stressor is losing her ability to walk and the possibility of losing her career due to her health. The stress of paying for 2 cars and her home weighs on her while staying here. She expresses frustration due to her young age at the rehabilitation center geared towards geriatric care. Due to her insurance, patient is no longer doing therapy. Patient expresses aggravation with the repeated health history questions due to the numerous student nurses. Family history. Patient's mother has hypertension and thyroid disease. Her maternal grandmother suffered from colon cancer and diabetes. System 1. Due to the patient's health history with her left eye, I chose to perform a head, eyes, ears, nose, and throat exam on her. Patient reports no headaches, dizziness, vertigo, or fainting. The patient uses glasses and a hearing aid to correct issues with difficulty seeing and hearing. The patient does not have bleeding or discharge from ears, eyes, nose, or mouth. Patient reports no persistent voice hoarseness, frequent colds, or sore throat. Patient does not have difficulty swallowing and does not have neck pain or tenderness. Upon assessment, I found patient's head to be round, symmetric, and related to body size. Lumps, bumps, or lesions are not present. On the face, skin appears to be of lighter pigmentation. There are no lesions, edema, or excessive dryness. The patient symmetrically moves jaw during the production of speech. Patient has complete range of motion in her neck. Her trachea is midline and cervical vertebrae appear to be straight and in line. All lymph nodes were less than 1 centimeter and tenderness was not apparent. The skin of the eyelids is intact without redness, swelling, or lesions. Her eyelashes are evenly distributed and curve outward. Her left eyelid does not open fully. Patient's left conjunctiva is red and appears irritated. The cornea is clear in both eyes. The irises are round and the same color. I was unable to palpate the left acromial apparatus, but patient states no pain or tenderness in her right lacrimal apparatus. Patient was able to read anything in her left eye, but her right eye was able to read a piece of paper 18 inches away and also 20 feet away. There is no peripheral loss on her right side, and she can only see light out of her left eye. Therefore, I was unable to perform the visual fields test. In her extraocular motor function, there is parallel tracking bilaterally. Her corneal light reflex is normal. There is no lateral or upward-downward movement of the eyes. The pupils are equal, round, reactive to light, and have accommodation present. Upon palpation of the eyes, normal findings were concluded. The patient is able to hear and repeat words correctly as seen by the hearing test. Due to the patient's inability to stand, I was unable to perform the Romberg test. After inspecting and palpating the patient's nose, paranasal sinuses, and mouth, I discovered all normal findings. System 2. Due to the patient's neuropathy, I decided to perform a neurological exam on her. Patient reports no numbness, tingling, burning, seizures, or loss of consciousness. Patient is occasionally concerned with her memory and ability to concentrate. She does not express insomnia. Patient has found that going to bed at 10:30 helps her sleep well. Patient sometimes experiences anxiety related to daily activities but usually passes it off as old age. She does not have difficulty producing speech. Patient suffered a concussion while she was in Vietnam in a Jeep accident while on the line of duty. Upon assessment, the patient scored a 29 of 30 on the Fulstein Mini mental exam, which makes her alert. She was only deducted points while trying to count backwards from 100 by 7. Due to her inability to walk, the patient could not perform testing for gross motor and balance, including the Romberg test and also fine motor function. Patient has full motor function in her upper extremity, as seen through touching finger to nose, examiner's finger to nose, and rapid alternating movement. Patient has stereognosis but does not have graphphasia. Babinski and acyclovir testing were deferred due to her confinement to a wheelchair. Pertinent systems. According to the American Diabetes Association Journal, it is important to assess muscular functioning because of metabolic agitations and diabetes due to changes in connective tissue. Patients with a long-standing history of type 1 diabetes, such as this one present, commonly have musculoskeletal complications. The patient has already had loss of motor function in her lower extremities. It is critical to ask the patient about her symptoms and monitor for more signs of musculoskeletal complications in order to help the patient to have the greatest independence she may in regards to activities of daily living. According to the British Medical Journal, it is critical to assess the integumentary system due to the patient's constraint to a wheelchair. She is more prone to pressure ulcers as a result of her weight constantly on the lower half of her body. Interference pressure, moisture, shear, and friction are the 4 main predictors of pressure ulcers. Bony premises will have the greatest external pressure. The patient's immobility and limited activity also leads to a risk for pressure ulcers. Assessing the patient's integumentary system will help to give her the best care possible in order to prevent more health complications from occurring.